Greetings, everyone, guests and presenters and Representative Craig and staff. I'm Emily Durand, Mayor of the City of Wabasha. I greet you tonight from a beautiful September evening on Wabasha's historic Main Street, which is just a block off of the mighty Mississippi River. And just this week, our city has been decorated with pumpkins and corn stalks and charming painted characters in preparation for our annual celebration of Septoberfest, which begins this weekend and runs through October 24th. As always, we would welcome you to visit us. Our businesses are open with mandatory precautions in place, and it's a terrific time of year to visit the Mississippi River Valley. Thank you, Representative Craig, for convening another town hall meeting and inviting our distinguished guests to address these issues. I'll quickly review this evening's ground rules and then pass it over to Representative Craig to lead us in the Pledge of Allegiance. So the ground rules include these. In order to keep the town hall respectful and make sure that we have time to take as many questions as possible, we will be keeping to these following ground rules. This town hall has Minnesota rules, which means we will treat all with respect. Tough questions are great and welcomed, and obscenities and disrespectful language are not allowed, as this prevents others from facilitating and enjoying the town hall forum. Questions are welcome in the public chat box, and they will be relayed and read by me to the presenters. After their opening remarks, Representative Craig's and the presenters' responses will be limited to 2 minutes so that we can have as many questions as possible. So if responses exceed 2 minutes, I'll prompt them to close, and this will allow for another question. I'll kindly let us know shortly before the hour, at which we will have arrived at 7 p.m., and we'll then hear 2 final questions and any closing comments from Representative Craig. And now I'm pleased to hand the virtual microphone to Representative Craig, who will lead us in the Pledge of Allegiance and introduce our public health presenters.
Well, thank you so much, Mayor Durand, and thank you for moderating once again our 21st town hall since I was sworn in as a representative for the 2nd Congressional District. I do always like to start my town halls by reciting the Pledge of Allegiance, but I also start every single town hall by recognizing this nation's veterans. And so I want to use this recognition of our veterans this evening just to remind everyone that our nation's veterans today on World Suicide Prevention Day have a 1.5 times rate of suicide of non-veterans. And so we all should recognize the sacrifice that each of these service members make to us and our country. And if anyone is having any sort of need, you can reach out to the National Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-TALK. And with that, we will kick off with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you so much, Mayor Durand, for being here this evening. I was in Wabasha earlier this week, so it's great to see you once again. You mentioned, of course, Septoberfest. We were decorated. It was fantastic. But also, if you're looking to take a little day trip down, there are the only member of Congress in the country who represents the National Eagle Center is from the 2nd Congressional District, and I am super honored to have that privilege as well. In addition, the Grumpy Old Men Festival takes place there every year, so don't miss it. Thank you for joining us here again for, as I said, my 21st town hall since I was sworn in as a new member of Congress. You know, we come together each month in person before COVID and now remotely, virtually, in order to properly social distance, really to do 2 things. One, so that I can answer your questions directly on the work that I'm doing in Congress, but also we've tried to use this as an opportunity to bring forth public health officials during this very difficult public health crisis. I want to start my comments tonight just by recognizing that we are approaching 200,000 Americans who have died as a result of this pandemic. These are 200,000, approaching 200,000 families who've lost loved ones, mothers and fathers, sisters and brothers. And so I just want to make sure we never lose sight that everything that we're experiencing here and its impact starts with a public health crisis and can end as we get through this public health crisis. You know, the impact that this has had on our economy, the impact that this is having just beginning this week again here in Minnesota as parents have to, with consultation with their children, decide whether their kids are going back to school in person, whether they're going back virtually, or whether they're participating in some sort of hybrid approach. As teachers like my mother, who is 69 years old and who decided to retire this year instead of her original plan to work until she was 70, to retire instead of going back into a classroom because of the COVID-19 pandemic. Administrators who are, doing yeoman's work here to try to get these facilities ready to be able to accommodate our students and teach our children. And then let me just say directly to this nation's teachers, thank you. Thank you to Minnesota teachers. I know that what we're asking you to do in normal times is difficult with not as much pay as you deserve, but I can promise you that every parent out here recognizes the work that you are doing in order to help our students learn and the risk you're taking in order to do that. So thank you so much for that. And parents, let me just add to all of that. I know that this is an extraordinary stress, especially those parents of young children who are able to work remotely and have children at home. But for many essential workers who can't work virtually and are having to deal with childcare issues. So all of these things certainly are on my mind as we start our nation's school back here in Minnesota as well this week. Let me just start by saying that I've been spending here much of this past month, other than the Saturday, the rare Saturday session that we were in Washington in my district. And I have visited, as I want to circle back around to the economy here, I visited businesses and local mayors in many of the towns inside the 2nd Congressional District. I've had the privilege of spending time in Lakeville, meeting with businesses in Red Wing, in Lake City, in Wabasha, in Northfield, in Savage, in South St. Paul, in St. Paul Park, in Zumbrota, all of these businesses. And my conclusion really is that this pandemic certainly has not had an equal impact on individuals, nor has it had an equal impact on businesses. And especially for those restaurant owners who were shut down or had to go to primarily takeout, especially for those retail owners, for the hospitality sector, for those nonprofits who didn't have access to the Paycheck Protection Program. I've talked to a lot of you over the last several weeks. And as I head back to Washington next week, I will continue to press for the Restaurant Act to get access to grants for our nation's restaurants, especially as you look at reduced capacity even further now that we're heading into a little bit colder part of the Minnesota seasons. Unfortunately, that little bit colder part has come just a little bit early here this year. What I'm going back to Washington thinking about too are the small business owners from throughout the district, businesses like Content in Northfield, who told me unequivocally that the U.S. Postal Service is a critical part of your business model, that without the U.S. Postal Service, you are not going to be able to meet your margins and survive as a business. And we will continue to fight not only to improve the service levels at the U.S. Postal Service that have declined dramatically over the last several months, but also to continue to make sure that the U.S. Postal Service is ready to assist Minnesota and around the country with those absentee vote by mail ballots. During the last month, too, I had the honor of visiting South St. Paul for a very special event. Many of you may know that the 19th Amendment 100-year anniversary occurred in August, and that was the first time 100 years ago that women in our nation could vote. And as we think about just that absolute pillar of democracy, voting rights, to be able to celebrate in the very place where women voted for the first time. You may not know the story that there was a municipal bond election. I believe it was the day after the 19th Amendment went into effect. And so it was a great event to have the suffrage movement sort of culminate in its celebration right here in the 2nd Congressional District. Over the last month as well, I've been able to meet with Dakota County commissioners and city officials to talk about the Veterans Memorial Greenway project in Dakota County, just an amazing project that I'm fighting for federal funding for. I've been able to get an update on Highway 169 project and some of the further work that needs to be done there in Jordan. Been able to spend time in Red Wing and the Prairie Island Indian community talking about the Sturgeon Lake project. And of course, we were able to announce that a $2.8 million federal grant for a new bus garage in Burnsville. All of these things are critically important to the 2nd Congressional District. As I head back, certainly what's on my mind as well is that on May 10th, the U.S. House of Representatives passed the HEROES Act. That act has not come before the Senate, and the Senate has not been able to move forward a new COVID relief bill. And so I will be continuing to encourage everyone to sit back down at the negotiating table and do what is required for the American people. And I'm sure we're going to be talking a lot more about that this evening in the question. So there's a lot more work left to do. This week, in talking with our educators, again, it was just reinforced to me how important the IDEA Full Funding Act is, and fully funding our public schools is to our community, how important the Humble Act is, and I'm going to keep fighting to make sure that members of Congress are not allowed to hold individual stocks we've seen during this pandemic. I'll keep fighting to make sure that none of us can serve as registered lobbyists once we leave this office. I will keep working across the aisle to fix healthcare. You know, healthcare and the economy were the two top topics, the two most important topics on the minds of Minnesota 2nd constituents before the pandemic. And so, of course, this pandemic has only raised that focus that the access and affordability to healthcare remains critically important, and I will continue that fight. And then finally, on behalf of a grateful community, I want to say thank you to the small businesses in this district. We know the stress and anxiety that this pandemic has caused and the economic challenges, and I will continue to fight for additional relief for you, whether that's grants to businesses that have been hardest hits like restaurants, whether that is access to a second round of PPP or forgivable loans for the hardest hit businesses. And as this virus continues to unfold, I will just keep working to make sure that good public policy takes center stage. And with that, I want to just end my prepared comments because we are so lucky this evening to have two special guests here on the panel with me in particular. And I want to take a moment to introduce each of them. Welcome to Dr. Ryan Demmer. Ryan is an associate professor in the Division of Epidemiology and Community Health at the University of Minnesota School of Public Health. And with him this evening is Dr. Kelly Searle, assistant professor, Division of Epidemiology and Community Health, again with the University of Minnesota School of Public Health. And what I am so incredibly excited about hearing from them for all of our benefit is really just their areas of specialty. Dr. Demmer, the effects of the pandemic in general, and shelter in place and all of the things that we've been experiencing. And then, of course, Dr. Searle, how the disease spreads through the population. So I want to kick things off by just asking Dr. Demmer for any opening remarks.
Sure. Good evening, everybody. It's a pleasure to be here. And as was mentioned, my name is Ryan Demmer. I'm an epidemiologist and associate professor in the School of Public Health at the University of Minnesota. So my longstanding research interest relates to the intersection between infectious diseases and chronic diseases. And I've often tried to understand how microbes can actually cause chronic diseases like heart attacks and diabetes and stroke on the one hand. And on the other hand, I'm also interested in how pre-existing chronic diseases can make people more susceptible to developing an infection or having a bad outcome if they acquire an infection, such as COVID-19. And that's really highly relevant in the context of SARS-CoV-2, the virus that causes COVID-19, because we've really seen that this is as much a cardiovascular disease as it is an upper respiratory disease. And people with pre-existing chronic conditions certainly have higher risks of bad outcomes if infected. So when COVID came along, given that background, it was sort of a natural progression for me to get started and initiate some research in this particular area. So some of the initial research I've conducted has been focused on learning a bit more about the threat of infection to healthcare workers in particular. And today I just wanted to take a little bit of time to provide a brief overview of some of that research and help better understand the risk of COVID-19 infection among healthcare workers, and particularly among healthcare workers without symptoms, and then say a few things about what that actually means for you and me in the community. So first, just a little bit of background on this area. Why did we want to study this? And there are a few key reasons why we were pretty interested at the outset in looking at symptom-free healthcare workers. So first of all, back in March, as we initiated the planning for this research, we knew healthcare professionals were really quite likely to be at a higher risk of infection because they faced a double burden of their profession, which on the one hand prevented them from staying home. The rest of us were sheltering in place. They had to go out and about, be in the community, interact with colleagues. And at the same time, they were forced to come into contact with potentially infected patients or patients that they knew were infected and required life-saving therapies. So we knew that they would be at higher risk of exposure. And second, it was clear or becoming apparent, at least early on, that a sizable fraction of new infections was likely being transmitted from individuals who initially looked and felt healthy. In other words, they had no symptoms. And we've come to find out actually that a good share of infections actually are passed from people who do not show signs and symptoms. And even for those that develop signs and symptoms, it's probably the day or two before those symptoms develop that they're most infectious, which is part of the reason this has been such a complex problem to address. And then finally, if we were concerned about all these things because if healthcare professionals themselves are likely to have an infection without symptoms, they potentially are a really important piece of the infection chain, and they pose risk to their patients potentially, in addition to the risk that they take on being in those settings. So the upshot is that we designed a study to ask the simple question, how likely is it that healthcare professionals without symptoms of COVID-19 infection are actually infected with coronavirus? So to accomplish this, starting in late April through the end of June, we enrolled about 500 healthcare workers from the Twin Cities metro area. We collected nasopharyngeal swabs from all participants, and we tested those swabs for coronavirus. And the results were actually really surprising and counter to what many of us were expecting. We found that none of those tested positive. So at the moment in time that individuals were tested, we were testing for live virus and active infection. None of those healthcare professionals were actually infected. And given the dynamics of how we designed the study, that suggested that what we call the point prevalence, or the probability that at any given time a healthcare worker was infected, if they didn't have symptoms, was probably much less than 1%. That's fairly noteworthy because initially when we were designing the study, we thought that maybe 2 to 5% of individuals would test positive. And that would have been a shockingly high number, because even in places like Florida and New York, during their peak, the probability that any given person in that state would be infected at a point in time was less than 1%. So why is this important, and what does it all mean for you and me in terms of our interactions with the healthcare system? Well, first of all, I think that while we know that healthcare workers are still quite likely to be at an increased risk of infection relative to the rest of the population, which is why it's important that they have PPE, and for the reasons stated above, the risk probably isn't as high as we initially thought if, and this is a really important if, the community rates of infection are low and hospitals are not overwhelmed. This gives healthcare providers the ability to ration PPE appropriately, treat patients with appropriate PPE, and just do basic things like take their time when they put the PPE on and take it off, because that's often a point in time when you can increase risk for transmission. So that means that if we all do our part to reduce community spread, we're helping to keep our healthcare professionals safer. The second message, I think, is that it means the risk of any individual getting infected because they actually go to see their doctor or nurse for treatment is probably extremely low, and people should definitely not be avoiding medically necessary visits to the doctor for fear of infection. Knowing that's fairly important because early on we saw some clear evidence that people were definitely avoiding clinical visits. Visits to the emergency room and doctor's offices in general were down dramatically all across the country. And there was a lot of evidence mounting that people were dying in their homes from potentially preventable causes of death. In other words, had they sought immediate medical attention, those lives could have been saved. And even in situations of non-emergent medical care, there are good examples of why some regular care should continue. One great example is childhood vaccinations. The Department of Health has been looking at this issue, and they've shown already a substantial decline in the state of Minnesota in vaccinations among children under the age of 2. And that's really concerning because vaccinations save lives and they keep people healthy. So the upshot is that the best evidence at the moment is that healthcare professionals have an increased risk of exposure to the virus, but the probability that they're actually infected at any given point in time is quite low. You should not avoid medically necessary care for fear of becoming infected. And the best advice is to call your healthcare provider if you have a visit that you think is necessary, or call 911 if you're experiencing signs and symptoms of a medical emergency, so you can get the proper care. I'll stop at that point and I believe turn it back over to Representative Craig or possibly to my colleague, Dr. Searle.
Thanks, Ryan. So good evening, everybody. I'm Kelly Searle. As was mentioned, I'm an assistant professor in the Division of Epidemiology and Community Health at the University of Minnesota School of Health. And I'm an infectious disease epidemiologist by training. And my research up until this point has really primarily focused on understanding malaria transmission dynamics to inform appropriate control and elimination efforts in a variety of settings in sub-Saharan Africa where malaria infection is endemic. However, over the past several months, I've been actively involved in COVID research to understand the transmission dynamics and actually model SARS-CoV-2, as Ryan mentioned, the virus that causes COVID, to model the transmission specifically here in Minnesota in projects in collaboration with the Minnesota Department of Health. And these are the transmission models where we model the transmission of the virus in the population in order to estimate the number of cases, the number of hospitalizations, to model the burden within the healthcare facilities, and potentially the deaths that could arise from these infections and cases. And these are the models that we worked to present with Governor Walz that were used very early on in the pandemic when we were trying to determine the best interventions to flatten the curve. And we've actually been working to update these models as more data and information come in to continue to project this transmission within the population of Minnesota and to project the potential number of cases and infections in the future, and to test potential new interventions and potentially what can be done to reduce individual risk in the population and overall spread in the population. And through this work, I've also been working on research to better understand things like mobility and contact patterns during normal times and how that's been reduced due to interventions in the population to inform these transmission models to get better estimates of the transmission and spread in the population, and also to estimate what the actual overall potential impact is of the interventions like stay-at-home orders and potentially masking to reduce the transmission. What can we expect in the future? And so I'm gonna stop here, but I'm happy to be here, and I'm glad to field any questions that arise.
I feel that there is so much chaos in the news right now, and that this is getting lost in the noise. Not seeing, certainly, I'll repeat the question. The question is for Representative Craig. Karen asks, what is being done to hold Louis DeJoy accountable and ensure that the U.S. Postal Service is running properly? I feel that there is so much chaos in the news right now, and that this is getting lost in all the noise. And that ends the question.
Well, thank you so much, Mayor Durand. So thank you for that question, Karen. It's a fantastic question. You know, I've been in direct conversations with members of the Oversight Committee. I know that a number of folks learned that the Eagan Post Office has lost some sorting machines. I've personally visited the Burnsville Post Office as well as South St. Paul. And look, I think, let me be clear, I think Louis DeJoy should resign due to his performance. The service levels that have really declined under his leadership have been unacceptable. When you think about the fact that 80% of our nation's veterans receive their prescription drugs through the mail, this level of service is just, it wouldn't be acceptable anywhere, and it isn't acceptable in a service that is provided by the federal government. The U.S. Postal Service is literally enshrined in our Constitution. I said he should resign, and if he doesn't, I think the Board of Governors should consider removing him from that post. Clearly, he is not up for this job. And so we will continue. I am not on any of the committees, but I certainly am listening to my constituents, the stories of delays in delivery of critical prescription drugs, the stories in the business community who rely on the Postal Service, as I talked about the bookstore in Northfield that I just visited. So we will make sure that this continues to be a high priority and focus for the U.S. House of Representatives.
Thank you, Representative Craig. The next question I'll direct to Professor Demmer. It's a public health related question. David says, I'm a pretty rational guy. However, I find myself not trusting my government so much. So I'm not sure I want to be the first in line for a vaccine. How can we trust what's happening in this environment where getting a vaccine before the election seems to be the goal versus good science and a safe and effective vaccine? Dr. Demmer, if you'd respond.
Sure. Thanks for the question, David. It's an excellent question. I think we should all be watching closely to see what happens with vaccinations. So we need a safe and effective vaccine first, and then we need procedures to ensure that vaccinations actually occur. A vaccine doesn't do anything if it stays in the syringe. People need to uptake it and become vaccinated in the population. The public trust is really important. And from my perspective, I have full faith that the scientists involved in this will present the evidence in a transparent and public way so that we can make good, rational decisions. The scientists that are behind this have been rigorously trained. We have a very good system of peer review. We know what needs to be done in vaccine trials to ensure that it's safe and effective. And as long as data are apparent and are transparent and publicly shared, I don't have any real concern with getting to the right decision. The things that would raise red flags for me would be a real lack of transparency, not making the data publicly available, not getting things into peer review rapidly. But so far, I haven't really seen any indications that anything like that would happen, despite some of the political rhetoric, which I haven't followed very carefully. And I can tell you that as a Minnesotan, in your backyard, you have a lot of national and global experts in this topic who will be the first to sound off if things look fishy, for lack of a better word. My colleague, Dr. Searle, and myself will be watching this closely, along with many other colleagues. Our colleague, Dr. Michael Osterholm at the university, is a global expert on this issue as well, and he certainly won't stand by if the data aren't being presented in a fair and accurate way. So at this moment, I wouldn't be terribly concerned, and I would stand by and wait for messages from public health experts.
Thank you, Dr. Demmer. Another question for Representative Craig. Linda asks, you visited a lot of small businesses. Is the PPP program, which is the Paycheck Protection Program, is it working for them? And what else is needed? Representative Craig.
Well, thank you so much, Linda, for that question. The answer is that for many of them, it truly was a lifeline. It has kept those businesses afloat for the last really 4 months. It was a little bit of a clunky start. I think there were 19 sets of guidance that came out from the Small Business Administration. I have some empathy because they were moving very, very quickly. And I think up until this point, the Congress has actually done a pretty decent job on a bipartisan basis in providing that small business support. We came back and we added some flexibility to the program with a bill that I co-sponsored. We came back and extended the program into August with a bill that, my bill, that the president signed into law on the 4th of July. So I would say that for many small businesses, it really was a lifeline. But you're right, I have visited with, probably 30 small businesses last week and this week alone. And what I would say is the virus itself is really going to determine what we need to do next, right? If we suppress the virus, we can get our kids back to school, at least from a hybrid perspective. If we suppress the virus, we can keep the economy open, even if it's not fully open at capacity levels that some of these businesses are used to. If not, and they were very clear with me on this, that they are going to need additional assistance. I was looking at data last week that 20% of businesses across the country anticipate that they may not make it through to the first of the year if the virus continues to be at the positivity rates in many of our communities that it is. So I think we're going to have to really stay on this. The HEROES Act had a number of additional improvements to the program. And the HEROES Act offered additional funding for the EIDL program, which are the grant dollars. So I think we're just going to have to stay very diligent. And the whole goal is to keep as many of these small businesses alive as possible until we get to this vaccine, so that we've got the economic engine of this country still running to get back to positive GDP growth.
Thank you, Representative Craig. That's a big question. I'm sure there'll be related questions. This question is for Professor Searle, and Mary asks, how long will we have to wear masks?
Thanks, Mary. That's a really great question. And so the purpose of masks is they're one of the few prevention methods that we have right now. So they prevent transmission. And what we're trying to do is to reduce the transmission to reduce the number of cases that occur. And how long we have to wear masks really is going to depend on how long transmission remains. And because masks physical distancing, these things, we're really limited in how we can prevent transmission without a vaccine. And so how long it'll last is really how long until we can have a safe and effective vaccine with high coverage where we no longer have community transmission in our population. And so rather than be able to say kind of in a time frame that this is how long this is going to last, we really have to see how the virus responds to the interventions that we have in place, and to be pretty vigilant with these interventions like physical distancing, hand washing, and wearing our masks whenever we do go into social situations where around other people. And so as long as the virus is present.
Thank you, Professor Searle. Again, for Representative Craig, this question is for you. It comes from Lucas, who asks, I was wondering what's being done right now to keep healthcare costs from going up too much, especially for those who were laid off during the pandemic.
Well, Lucas, this is such a good question, because when we passed the HEROES Act, unemployment across this nation was somewhere around 10%. We had reached unemployment levels in the state of Minnesota that we haven't seen since the early 1980s. And part of that package was assisting folks who had been laid off from their jobs in order to retain that health coverage. But step back for just a minute. We should have reopened public enrollment when this pandemic began into the Affordable Care Act, the individual marketplace. We are in the middle of a public health crisis. What we also should have done is made sure that everyone in this nation had access to rapid testing. What we should have done much, much faster is to call up the Defense Production Act and manufacture personal protective equipment so that our nation's essential healthcare workers are not having to reuse some of the equipment that they're still having to reuse. What we should have done is use that to get personal protective equipment to those long-term care centers around this country. And what we should do now, still, because in my mind, it's never too late to do the right thing, is we should make sure that our states are not competing against each other, that our businesses, for that matter, are not competing against each other for access to personal protective equipment in order to suppress the virus. And now you've got situations where in order to reopen the economy, businesses are also having to do the same thing. It's a much longer conversation, obviously, around what do we do about healthcare costs in this country. We've got to make sure that this does not result in health insurance costs going up. And at the end of the day, I think the biggest thing that this pandemic has laid bare is that, a fee-for-service pay system based on volume, where healthcare is based on volume, is not a sustainable healthcare system. And so that's a conversation that I look forward to continuing to have and lead.
Thank you for that. Another big question. And so now back to our public health professionals. We'll start with Professor Demmer. Ibad asks, how do we make sure we keep the pandemic under control through smart public health policy? Dr. Demmer.
Yeah, that's a great question. And, there are probably some very complex answers we could get into, but simplistically, I think we can do an awful lot by wearing a mask, keeping your distance, and staying in small groups. Representative Craig mentioned our soldiers who put their life on the line every day so that we can maintain a certain standard of living and an American way of life. What most of us are being asked to do in the communities is wear a mask, and it's a reasonably small thing to do, and it is effective. So I think those are really key things. And then it was also just mentioned moving policy that can get us closer to an accurate, rapid, cheap test would be incredibly important. And some of the professional sports leagues are already sort of onto this. And I hope that we can benefit from what they have learned, because that would be a game changer even before a vaccine, if we can rapidly test people cheaply so that they can go out and engage in the economy.
Thank you, Dr. Demmer. And Dr. Searle, the same question, which was related to how do we make sure we control the pandemic with smart policy?
Right. And so I agree with everything that Ryan just said, is wear your mask when you do have to go out into public, and physically distance when you can, when you're in public, even if you are wearing a mask. Those are things we can do individually, and they're relatively small things. And if we do them and we do them well and we do them consistently, we can see an impact. In terms of the testing, getting that out and making it available for everyone, and letting the policy be driven by good public health, and listening specifically to the public health leaders and the researchers, and following the science that's being presented.
Thank you both. Again, back to Representative Craig. Deja would like to know more about your work to grant LGBTQ folks better protections when they are adopting children. And she wants to know how that's going.
Well, thank you, Deja. It is really an honor to have served in the U.S. Congress with Congressman John Lewis. And he was the lead author of the Every Child Deserves a Family Act. And I was privileged to be able to work with him on that piece of legislation. And so that work continues. Obviously, my own personal story I've shared publicly before. My wife and I, we have 4 sons. Our oldest son, Josh, is adopted. And we did face challenges in a different state with adopting him as a result of him having 2 moms. And so, you know, I think that the goal here is to make sure that the only thing that matters is that a child is given a safe and loving home in this community. And we recognize that no one should be discriminated against based on who they love. So, you know, it's work that we will continue. You know, I am just absolutely committed in everything that I do to making sure that I'm reaching across the aisle, even on issues that are tough. And so I continue to talk to my colleagues about my own personal story. And I can tell you that my son Josh would say, because he says all the time, the hardest thing about having 2 moms is he just didn't get away with much when he was young.
Good for you then. So this question is again for Professor Demmer, and then actually back to Representative Craig on the same issue, because it has a public health implication as well as an implication for the economy. Has our supply chain been able to adapt to make the equipment that we need available? So people were talking a lot about that at the beginning of the pandemic, but there hasn't been as much discussion lately. Dr. Demmer.
Yeah, another really great question. And I would say many things have improved. So if we think about supply chain for things like swabs and testing reagents, the situation certainly has gotten better since April and May, without question. When we started to design the healthcare worker study I talked about at the outset, I tried to order swabs and they were back ordered until August. And this was back in March. The only reason we're even able to do the study is because a colleague of a colleague on the other side of the globe found out we needed them and graciously shipped 500. And that's how we arrived at the sample size of 500. Now things are better in terms of getting those supplies, but I really can't answer the question very well, big picture, because I don't know. And a lot of this information is not very transparent. It would be incredibly helpful for me, even as somebody who's following this stuff very closely, if we had a better infrastructure for listing out supply chains. What is our testing capacity? What is our treatment capacity? What is our capacity for making masks over the course of the next month or 3 months, for example? But I don't have a good sense of that. I know the situation has gotten better in terms of testing supplies and PPE, but how long that can last, especially if we have a major surge in the fall, is unclear to me, unfortunately.
And Representative Craig, maybe you can speak to your conversations with constituents and or colleagues in Washington.
Well, thank you so much, Mayor. You know, it's a great question, because even before the pandemic, I helped co-found 2 Democrats, 2 Republicans, the Supply Chain Caucus of the U.S. Congress. And there were 2 particular areas that I was very interested in that have only become more interesting during the course of this pandemic. One was the healthcare supply chain. And the other is our food supply chain. And of course, both of these supply chains have been tremendously stressed during the COVID-19 pandemic, I have been calling since day one of COVID-19 for a supply chain czar. You know, I'm so impressed with your comments, Dr. Demmer, and really, to me, that's exactly the right question, right? How many tests do we need to have access to? And of course, we know they have to be in order to be most effective for contact tracing. They've got to be accurate, they've got to be rapid, they've got to be cheaper than certainly the currently available. So how many do we need if we want to reopen our schools, if we want to keep our economy open or even further open our economy? What would it take? Because I have every belief in the world that if we said, in order for this to happen as a nation, we need these 30 manufacturers across our nation to come together under the Defense Production Act. The president has the authority under the Defense Production Act to do this, to say, we're going to help you get up and running, and we're going to make sure that we are manufacturing. And of course, you know, a licensing agreement would be put in place for the original manufacturer, and we're going to produce that many tests. I believe that America could do that, and we could have done that 3 times over the last 6 months. I also believe we could do the same thing on personal protective equipment. That if we said we need 30 companies to step up and do this, we're going to invoke the Defense Production Act, we're going to give you a licensing fee, we need your help to do this. I believe we could have done it. And so this supply chain czar, what do we need in order to reopen the economy, get our kids back to school? Let's put American manufacturing and ingenuity in place. Let's invoke the Defense Production Act. Let's stop having our states compete against one another for these supplies. Let's work together as a country. And, you know, I have my observation, and it's why I try during COVID-19 to always have a public health expert at my town halls, is, you know, what I just said is what I believe we should do from a public policy perspective. But I believe that health advice primarily should come from health professionals, not political leaders. And so, you know, I hope that the two of you, I so appreciate you being here, because, you know, we need to get the message out that masks are effective. I was just at a meeting earlier today where a constituent was questioning, again, the effectiveness of masks. And so, you know, we really need to get that message out. And so, again, thank you for sending it here on the town hall this evening.
Thank you. This question is again for you, Representative Craig. Vicky asks, do you think the federal student loans will be continued to be deferred as the pandemic continues?
Well, I sure hope so, Vicky. We certainly thought of that as part of the HEROES Act. That was the 5th COVID-19 relief package that the House passed on May 10th. Some of you may have seen today that it looks like the Senate is not going to be able to get a relief bill over the finish line in order to come together through what's called conference committee in order to essentially negotiate those final packages. And, you know, I was on a call earlier today where I again encouraged both parties to sit back down. If the Senate can't get support for any bill, and you know, that seems to be the case. Mitch McConnell has said specifically that you know, basically half of his Republican caucus doesn't want any more relief bills. But we know that that people continue to hurt. We know the unemployment rate continues to be high. We know that on average, it's costing our schools another $1.8 million in order to reopen. I had a roundtable yesterday virtually where we brought a lot of school leaders together, and I really wanted to understand, where do these increased costs come from? You know, think about the challenges of busing during COVID-19 with the hours, especially in a hybrid approach. Think about the additional both cleaning and disinfecting that's required in our buildings. You know, my youngest son is a rising senior at Rosemount High School, and he's going back next week in a hybrid approach. And of course, there's just increased cost to having different sets of kids in and out each week. When you think about the cost of our administrators and our teachers being able to help those students who are on individualized education plans, of special education students to meet their goals, that's an increased cost when you're in a virtual or hybrid learning environment. So, you know, it's a challenging time. I continue to encourage both sides of the aisle to come together, but I'll just be candid with my constituents. The way that the prior relief bills got done, it was actually the White House negotiating directly with the U.S. House of Representatives. The Senate has not really wanted to participate in any of these discussions. So I would just say that the need for state and local assistance, the need for assistance to our nation's schools as we try to reopen, assistance to our essential workers, our first responders, our police, our fire, our EMS, our healthcare workers, has never been greater. And we still are at unemployment levels that we haven't seen in a very long time. So, you know, thus far, the Congress, and I'm going to give everyone credit for this, even though we've been presented a set of bad choices in some instances, have done what we need to do to continue to stimulate the economy. And what economists tell me as I listen, it's if we can come out of this in a recession, we're going to be lucky. And we have got to be brave, and we've got to be bold, and we've got to make public policy choices based on data, not on politics, if we want to come out of this and get back to positive GDP growth as quickly as possible.
Thank you. Back to Dr. Searle, a question related to our behaviors as the weather changes, which it already has, as Representative Craig pointed out. What can people do to keep the infection rate low as we head into fall and winter? I keep hearing that people going inside as it gets colder will lead to a spike. How do we balance not being isolated and staying healthy?
That's a great question. And it is of note that once it gets cold, we do kind of go inside, and being inside in groups has the potential to facilitate transmission more so than being outdoors when the weather is nice, which we've been taking advantage of. But right now we already do have some of the tools in place as we move into the colder weather. And so in public spaces that are open, capacities have already been reduced in most places down to like 25%. And we're encouraged to wear masks when we're in those spaces indoors. So keeping the capacity low and wearing masks when we're in those public spaces. And if we can't be outside for social gatherings with our friends, if the numbers are low and we go inside, it's recommended to wear your mask when you're inside, but keep those groups really low when you have those social activities. And if possible, do things virtually if you're able to. And lastly, as we do move into the colder weather, it's also a reminder that it is flu season coming up as well. So please go get your flu shot if you can, because we don't really want to have compounding respiratory infections happening and increased vulnerability at the same time that we're in this pandemic.
Always a good time to advertise flu shots, and I got mine today. So I needed the reminder about a week ago. And again, back to Representative Craig, I'm sorry, Angie, this one's for you. From Siri, she asks, what can be done to help newer businesses during this pandemic? Many don't have access to the same resources that other businesses have, especially ones that have been around for several years or generations.
Siri, that's such a great question. And just for the record, Mayor Durand, I have my flu shot scheduled for Monday. So there you go. Siri, it's a great question. And I was just in Zumbrota here this week and talking to essentially a business owner who didn't have access to that 1 year of records that he thought he was going to need to get the Paycheck Protection Program. And so I do think that this has been a gap in some of the federal assistance and help. When you think about what the EIDL program grants were originally supposed to be, I think that would have certainly been very helpful to a new business. And I'm really pleased to see a lot of our local communities, our towns and our counties offering from the CARES Act funding they receive from the federal government, direct grant assistance to some of those local businesses. So, I've actually been really pleased as I've done the downtown tour throughout my congressional district at really the number of businesses that, I always ask my local mayors, and I asked Mayor Durand the same question. Have you seen a lot of businesses go out of business during this pandemic? And when the answer comes back, and I'm happy to have you comment on this, Mayor, if you're comfortable. But the answer has mostly come back, not a lot, not very many. We're not seeing a ton of additional vacancies of our downtowns that we didn't already have or anything like that. And I do think that the CARES Act funding that we're providing for our cities and our towns is having an impact on this as well. But I actually think this may be a gap in some of the federal support that the Congress should take a deeper look at.
Thank you. Yes, I worry about that every day because, as you'd mentioned before, it's a month-by-month scenario for some of these businesses. They're projecting now into a quieter quarter, and so they have to make decisions. So we're still concerned about all of our local businesses, even those that had strong summer seasons. We rely on strong summer seasons in a tourism economy, and not all of our businesses are tourism. We have service sector folks, of course, but that's going to be a question for them as they approach winter. The next question is, this would be a final question for you again, Representative Craig. Susan asks, is anyone talking about arts and artists? Musicians, actors, and performers are unable to work at all. Many don't have steady employment outside of this due to the nature of their professions. Are there discussions taking place about how to help them?
Yeah, there actually have been on the U.S. House side. I know there's a specific bill that would help that segment of the arts segment of our community and industry. It's really just so sad how many of these just wonderful local theaters. There's a really neat one, by the way, in New Prague. I was trying to remember exactly where it is in our community, and I visited several weeks ago now, and obviously they have been completely shut down. But you think about all of those different sectors, the hospitality sector, the arts. I mean, these are a lot of the folks who are reliant and dependent upon the unemployment benefits that the federal government has been providing. And so, there's a lot of sectors you don't think about when you think about a place like Wabasha. Again, it was good news that folks, from the cities are starting to get back out and take some day trips to places like Wabasha and Zumbrota. But as the weather turns, it's going to be more and more difficult to do that. And some of those seasonal businesses, those tourist-reliant industries, those stage theaters, we are going to have to think about, is there a grant program similar to the Restaurant Act that we need to put in place there? My understanding is that is conversation on the House side, and that has been pretty much left out of the Senate discussions. But again, these are folks who have been gainfully employed and they find themselves without a job now, and they're still furloughed, many of them, and we need to make sure that we don't cause this cascade or parade of horribles when you start thinking about the impact on food security, on housing security. We're already seeing some of that, and I think we've just got to stay alert, and we've got to stay apolitical and do the right thing from a policy perspective to make sure that we are holding this economy together in the short term. And if we do that, I have no doubt that businesses across this country are going to be able to accelerate their recovery, and that we're going to work together as a country to be stronger than ever. It's going to look a little different. That's why I keep saying our economy post-COVID probably won't look like it did before COVID. You've got, a virtual economy that has emerged as a result of this. You've got one of my passion areas, which is career and technical education, trade schools. There's going to be a lot of different jobs, and we've got to make sure from a federal policy perspective, whether it's in our nation's high schools and middle schools, whether it's those post-secondary schools, that we are preparing the next generation for the jobs in the workplace moving forward.
Thank you, Representative Craig. We're coming up at the top of the hour. We have 1 minute to 7. If you have any other comments or closing remarks that you'd like to share. we'd welcome them.
Well, thank you so much. My closing remarks really are just around saying thank you to Mayor Durand for moderating here this evening, saying thank you to Dr. Ryan Demmer and Dr. Kelly Searle for providing such great information to us. And my last comments to my constituents are just that I know that there are times when the fatigue sets in. I know that mental health challenges are on the rise for many students and individuals and adults. I just want to tell you, keep the faith, because I think we're going to continue to work to listen to all of you. And I trust the healthcare professionals and the scientists. And so thank you so much for the opportunity to serve this district, to listen to each of you, and to be part of such an amazing community in the 2nd Congressional District. Have a good evening.